Good morning and welcome and thank you for being here today. My name is Eric Nelson and I'm the Director of Advocacy for AARP South Dakota. We appreciate you joining us today for this conversation about the Medicaid expansion and the upcoming implementation date. Joining me up here today are our speakers, Ms. Lisa Thompson from Mitchell, Dr. Jen Tingley from Falls Community Health, and Dr. Dan Johnson, a volunteer for the American Cancer Society, Cancer Action Network, and a retired doctor out of Yankton. Also to my left are a couple navigators that will be assisting Ms. Thompson with her Medicaid application, Medicaid expansion application after our event here. This journey has been about a decade in the making, as the issue of Medicaid expansion was a topic across several years of legislative session, but without any success. That is why the coalition South Dakota Decides Healthcare came together in 2021 and grew to be one of the largest coalitions ever to come together for a ballot initiative. It was comprised of healthcare organizations, farmers, educators, faith-based organizations, tribal organizations, small business owners, and chambers of commerce. Throughout the 2022 campaign, this coalition talked about the importance of healthcare access to hardworking, low-income South Dakotans. And an overwhelming majority of South Dakotans, our voters, agreed with our initiative and passed Amendment D with 56% of the vote in November 2022. Medicaid expansion provides coverage to ensure people are able to get the care they need when they need it. Our first speaker today sees patients each day who have health insurance and those who do not, and sees the difference it can make in people's lives. Please welcome Dr. Jennifer Tingley, the Chief Medical Officer for Falls Community Health. Dr. Tingley?
Thank you. Hi, thank you so much for joining us here today. As Eric had mentioned, I have been employed here at Falls Community Health for 9 years, and I actually trained here as a resident, so I've been here over a decade. I'm a family practice physician, and as a family practice physician, we see patients of all ages, babies up to 80, 90-year-old patients. Here at Falls Community Health, just over half of our patients are uninsured. I think we're right at 50%. So every other patient that I see in my exam rooms does not have insurance. And I will tell you that it is very difficult to provide patients with the care that might be best for them for the conditions that they're coming in with. It's just so much easier if I have a patient in the room that I can prescribe a med to the pharmacy and I know that they're going to be able to pay for it because they have their insurance covering it. I think about, we've got Dr. Dan Johnson here. He's an orthopedic surgeon, and this is one of the issues that I see all the time is patients will come in with knee pain, hip pain, something on that order. We can provide services here at Falls Community Health, and I'll talk just a little bit about what we can do here. And we offer discounted fees for that service, for the x-rays that we do on site, or the medications that I prescribe. But again, I can't control the cost at the pharmacy. But if I think that this patient might need physical therapy, or I think maybe they need to see an orthopedic surgeon, that becomes very, very expensive for a patient to do. And often they just don't do it. And so what we're left with is prescribing pain medicine or doing nothing, and patients are suffering. So for me, Medicaid expansion was a huge win, something that I've been begging for years. I'm a South Dakota resident. I'm so proud that we made this happen for our residents, for our patients. And I'm excited for our providers, our nurses, our whole team here that we are now going to have more options for our patients that truly need that care. So like I said, Falls Community Health is a federally qualified health center. There are clinics like ours across the country. South Dakota has a lot of FQHCs, is how we shorten that phrase. We provide services on a discounted fee, and so based on a patient's income, they may qualify for a very low copay to come in and see us. But obviously having insurance is just a better way to go, because even 50% of a clinic visit, which might cost $200, it's still $100. And a Medicaid copay may be $0, it may be $10. It's just so much better that we are doing this. And so very, very happy to know that with Medicaid expansion, we are going to probably increase about 52,000 South Dakota residents that are going to gain insurance. And that will be based on income. And I do have numbers because I think it's important for people to realize that there are still some income requirements that are there. But anybody the age between 18 and 65 who are earning less than $20,000 a year will will now qualify for our expanded Medicaid coverage. And if you have a family of 4, if you're part of that family of 4, but that family is earning less than $41,000, they will now qualify for Medicaid. So again, so happy that this is happening. I'm so excited that you're all here to celebrate this win with us as we get to start enrolling kind of these new arrivees to the Medicaid system. And I'm happy to introduce one of our South Dakota residents who is going to be very excited to be signing up for Medicaid right now. Lisa Thompson is a Mitchell resident who currently is not insured, but with these new expanded rules will now have access to the health care that she deserves. And that many, many other residents deserve as well. So, Lisa, if you want to come forward. Yeah.
Thank you. So, in June of 2021, after my youngest son went off to college, I immediately moved back to my home state of South Dakota. In spite of having already been diagnosed with a whole slew of chronic health problems, when I lived in Minnesota, I was able to manage these issues because of one thing: Medicaid. Having Medicaid meant that I could get the prescriptions I needed and see specialists at the Mayo Clinic. Management of my health meant that I was able to work in the areas of freelance writing, nannying, and Uber driving. Perhaps it was naive on my part, but having never heard of the phrase Medicaid gap, it didn't dawn on me to make sure that I would still be able to get health insurance once I moved to South Dakota. When I found out that I wasn't eligible for any state or federally funded health insurance in South Dakota because of this gap, it felt like I had been delivered a death sentence. Having used all of my financial resources to move myself to Mitchell, South Dakota, I couldn't afford to move to a different state that offered health care. Nor did I want to, because South Dakota was the place where I grew up, where the people were friendly, jovial, loyal, and salt of the earth. The place where the Dakota sunsets and rainbows could take my breath away. The place where my best friend Heidi, who I met at Camp Tibitaka when we were 10 years old in 1975, was still my best friend after almost 50 years. Living in the Medicaid gap meant that there were many medications I could no longer afford, and doctors I couldn't afford to see. Going off of my monthly RA injection, ADHD med, osteoporosis injection, and antidepressant created a snowball effect where my symptoms became so bad that there were times when I just didn't know if I was going to make it. Even though I'm only 58, with my rheumatoid arthritis and osteoporosis treatment, I had started experiencing numerous falls that resulted in fractures, broken bones, and at times an inability to walk without a walker or scooter. Without the right ADHD med, focus became a constant struggle, and without the right antidepressant, my depression became a constant challenge, all of which made freelance writing and being an Uber driver nearly impossible. While I had started working as a nanny for an 18-month-old boy whom I adored, I had to quit this position because there were days I couldn't function well enough to consistently provide the care for him that he needed. I've always been a fighter and was thrilled last summer when I found out that there were South Dakota organizations looking for community involvement to help advocate for the passage of Medicaid D. I was even more thrilled when the people of South Dakota voted to pass it this last November. Even though my struggles have felt insurmountable at times, today is a great day because just this morning I enrolled for Medicare coverage that will start in July. I hope and pray that all other eligible South Dakotans will do the same and reclaim their lives through being able to access the health coverage that they need and deserve.
Thanks, Lisa. Now I'd like to welcome Dr. Johnson from Yankton.
Good morning, everyone. My name is Dan Johnson, and I'm a volunteer with the American Cancer Society Cancer Action Network, and I'm from Yankton. I volunteer with the American Cancer Society because I lost my mother, Margaret, to metastatic breast cancer when she was 58 years old. Her tumor was discovered very late, and she only lived 18 months after her diagnosis. She had no health insurance, and through the years since, I have always questioned, what if she had seen someone sooner? What if our little hometown's medical clinic hadn't shuttered several years earlier? And what if she had had health insurance? Well, because we, as a state, voted to expand Medicaid, there will be far fewer folks wondering what if. Increasing Medicaid eligibility means South Dakotans will have access to comprehensive coverage, including cancer screenings, diagnostic testing, treatment services, and follow-up care. Expansion provides health coverage to individuals and families who fall into the coverage gap. Working South Dakotans who earn too much to qualify for the current program or too little to get financial help to purchase private insurance. Expansion increases primary and preventative care, reducing the cost of uncompensated care and enhances continuity of coverage. It protects patients' access to care, especially in rural communities. Women who reside in Medicaid expansion states are much more likely to get screened for breast cancer. The Radiologic Society of North America reports that low-income women in states that have expanded Medicaid are 25% more likely to get screened for breast cancer than those states that have not expanded Medicaid. A recent study led by the American Cancer Society found that the states that participated in Medicaid expansion were associated with an increase in 2-year overall survival rates among patients newly diagnosed with cancer, especially among Black people and people living in rural areas. Medicaid expansion saves lives. Every day we hear stories from cancer patients and cancer survivors, truly inspiring stories of South Dakotans getting care and triumphing over this deadly disease. But we also hear stories that are heartbreaking, especially because our state has had a coverage gap. My wife, Dr. Mary Milroy, is a retired breast cancer surgeon. And through her years of practice, she encountered numerous individuals that, upon being presented with a diagnosis of cancer and hearing how much it was going to cost to care for that, were really put into a financial turmoil. There was one case in particular that she told about. That was a woman that came to her with a diagnosis of breast cancer. This patient did not have health insurance, and she did not qualify for Medicaid. After learning what her cancer treatment would be, she told my wife that she would not allow the cost of her cancer treatment to bankrupt her family, and she left the office. This patient, like many other South Dakotans, had to choose to forego much-needed health care because of their financial state. My wife was deeply saddened when she read that patient's obituary in the paper about a year later. No one should have to choose between bankrupting their family and getting the health coverage they need. For the thousands of South Dakotans who have fallen into the coverage gap, today has been long overdue. Thank you. Eric Nelson has a few other words.
Thank you, Dr. Johnson. And just to wrap up here, I'd like to thank our host, Falls Community Health, for letting us have this here today. I'd like to thank our panelists again, Dr. Tingley, Dr. Johnson. I'd especially like to thank Lisa, Ms. Thompson, for sharing her story with us. ARP South Dakota, along with the American Cancer Society, Cancer Action Network, the American Heart Association, the Community Healthcare of the Dakotas partnered to put this event on today. Following our Q&A session here, we'll have Ms. Thompson over with the navigators to look at the application process. As has been discussed, we are here today because the application process for Medicaid expansion has started leading up to the July 1st enrollment. There are 52,000 South Dakotans that will be eligible for this program, and as has been mentioned, these individuals are working South Dakotans that are contributing to our economy, that are going to have access to health care for healthier and more productive lives across our state.